Hello, everyone. I'm Carrie Thibodeau, the National Director of Programs and Public Policy at the Kidney Foundation of Canada. Welcome to today's webinar, Self-Advocacy and Kidney Disease, Finding Your Voice. Before we begin, it's important to recognize the Indigenous land that we're on. Inspired by the 94 recommended calls to action made by the Truth and Reconciliation Commission of Canada, land acknowledgements are a necessary first step toward honoring the original occupants of a place. They also help Canadians to recognize and respect Indigenous peoples' inherent kinship beliefs when it comes to the land, especially when those beliefs were restricted for so long. I acknowledge with gratitude and respect that I'm joining this meeting today from Newmarket, which is the traditional territory of the Haudenosaunee, the Wendat, and the Anishinaabe peoples. If you know the territory from which you're joining today, please feel free to share it with us in the chat. I would like to now invite my colleague, Craig Lindsay, to introduce himself and walk us through how to participate in the webinar.
Thank you, Carrie. Good morning or good afternoon, depending on where you are joining from today. I'm Craig Lindsay, Director of Programs and Public Policy with the Ontario branch of the Kidney Foundation.
The Kidney Foundation of Canada would like to thank our sponsors for the 2025 webinar series, Accenture, Otsuka, and Sobi. Their ongoing support allows us to offer meaningful educational opportunities like this one and empower people to better manage their kidney health.
The information shared in today's webinar is current as of today, Wednesday, July 30th, 2025. The materials shared in this presentation are not intended to be medical advice. The information provided is general in nature and does not necessarily cover all circumstances. While we make every effort to be accurate, we recommend that you seek professional medical advice for your individual questions. Today's online webinar allows us to talk about practicing self-advocacy while living with kidney disease. What does that mean? It could be something as simple as learning to feel comfortable asking your care providers questions. It might involve wanting to be updated on test results regularly and having them explained to you in a way that makes sense. It could mean knowing all your options for treatments. Lots to explore, and I'm pleased to say we have here today several experts to help. They have learned many of the skills of self-advocacy through their own kidney care journey, either living with kidney disease or supporting a loved one in their own kidney care journey. To start the conversation, I would like to introduce our first panelist, Michael McCormick. Michael has been on hemodialysis since 1987, and at the age of 18, he has spent considerable time in hospital and in the medical healthcare system, dealing with complex complications related to chronic kidney disease, or CKD. Michael contributed to the formation of the Ontario Renal Network Patient and Family Advisory Council, recently receiving acknowledgement for 10 years as a committed member of that PFAC. Michael is also a founding member of CanSolve CKD, which is a national research organization focused on patient-oriented research objectives with a special emphasis on Indigenous health needs. Outside of living with CKD and many related volunteering roles, Michael recently retired from a 30-plus year career in the financial services industry, most recently as a service manager in the Market Operations Department of the Toronto Stock Exchange. Michael lives in Toronto with his spouse, Heather, and their furry cat child, Spicy C. Welcome, Mike.
Thank you, Craig.
Happy you're here, Mike. I'm happy now to introduce Erin Abercrombie. Erin is a mom to a 9-year-old boy who was born with chronic kidney disease, secondary to posterior urethral valves. At just 3 years old, her son Daxton received his first living kidney transplant from his father. An unusual complication caused this kidney to clot off, and it was removed just 5 days later. At 5 years old, after a short time on peritoneal dialysis, he received a deceased donor kidney. This kidney lasted just 5 weeks before a very serious yeast infection at the graft site caused it to be lost as well. Her husband and Erin were by his side while Daxton fought for his life. Daxton has been on hemodialysis now for 4 years, and she has been there with him every step of the way as his caregiver, his liaison, and his advocate. She interacts tirelessly with the medical team on his behalf. She and Daxton visit the University of Alberta 3 afternoons each week so that he can receive treatment. She has navigated the healthcare system and an extensive medical team for all 9 years of Daxton's life. She has 4 older daughters and is a foster parent as well. She was a teacher prior to becoming a parent. Welcome, Erin.
Thank you for having me.
Happy you're here. I'm pleased now to introduce Cleo Slattery. From wife and mother, employee, and now to full-time caregiver, her journey has been one of love, resilience, and transformation. For the past 7 years, she has cared for her spouse through kidney disease and many other complex health challenges, learning to navigate the healthcare system and becoming both partner and advocate. These experiences reshape their lives and deepen their strength, and she is grateful for every lesson, every struggle along the way. As a self-employed employment liaison and coordinator, she guides clients through their own change and growth. Her caregiving journey allows her to connect on a personal level with those facing life transitions, uncertainty, or reinvention. Caregiving for her spouse has been an emotionally complex journey. It can be confusing and exhausting as you navigate all the appointments and daily responsibilities for your loved one. She is honored to share her story in hopes of inspiring empathy, empowerment, and connection. Hi, Cleo.
Hi, I'm glad I could join you from Vancouver,
Happy you're
uh,
here.
from BC. Yes.
And lastly, Kathy Schmidt, with over 30 years of nursing experience. Kathy has had the privilege of working across a wide spectrum of healthcare settings, from rural outposts to large tertiary care centers. For the past 25 years, her professional focus has been in nephrology, a field where she has found both professional challenge and personal reward. She has served as a frontline hemodialysis nurse, a clinical instructor mentoring other staff, and she has worked in a multidisciplinary kidney care clinic. Most recently, she has taken on the role of transplant liaison, supporting, coordinating, and educating patients through their journey, hopefully towards kidney transplant. One of the most fulfilling aspects of her work is helping patients understand their condition and empowering them to take charge of their health, whether it is slowing the progression of kidney disease or making informed treatment decisions. She believes knowledge and support are key to improving not just outcomes, but a higher quality of life. Outside of work, she finds balance and inspiration in nature and community. She enjoys spending time on her boat or kayaking in the beautiful Georgian Bay, hiking local trails, getting lost in a good book, and sharing coffee and conversation with friends. Welcome, Kathy. Let's start the discussion. I'm going to ask, and I hope the panelists unmute and chime in. I would like to know, Mike, perhaps let's start with you. When did you first realize that you actually needed to self-advocate for yourself? Was it one thing that happened? Was it a revelation? What opened that book for you?
Um, Thanks, Craig. I think that I'm not sure it was a specific revelation, more so than like just the general understanding that in a complex world of kidney disease where you often have cardiologists involved as well and respirologists, the kidneys have a way of affecting more than just the kidneys. And it was the realization that the only person that had sort of the grand view of what was going on with me was me. And it was fairly early on in my journey that I was like, okay, I have to learn to speak the language of the medical personnel. I need to be able to um, understand like when there's um, conflicting diagnosis or just general disagreement on what a particular symptom means, um, that I could rather than wait to get everyone in the same room, which almost never happens.
Mhm.
It was just much easier to gather the information and say, okay, what you just told me seems to me like it was sort of very different from what the previous doctor told me. So, so just started out like that. There was nothing like I didn't get hit by lightning or anything like that. Just very much, you know, uh, the only person in the room that knows me the best is me.
That's well said, Mike. Um, Aaron, I wonder, as you reflect on what Mike said, was it similar for you that you realized Ernie and Daxton's kidney care journey that you were the connector of all the people?
Absolutely. Everything Mike said rang true for me. And I used to be, I think I still am, but I definitely had this strong sense of I need to be like the good girl. The doctors are way up here. They know what's best. They know everything, and I need to do everything they say. And that's definitely how it started. And I would get frustrated. Like Mike said, there was often contradictory stuff being said from one doctor to another. And after being frustrated, one particular example where I really thought was like, I need to do something differently. My son used to, every time his creatinine went up, they would increase his fluid intake, and he is G-tube fed, and I would have to increase fluids by a significant enough amount that it would make him vomit more. And I was like, this isn't making sense. He's just losing more through vomit when I'm giving him more. And I just followed their instructions for a while, just feeling frustrated. And finally I realized, you know what, this doesn't make sense. I need to tell them. Um, and and they listened to me. And we developed a plan where I wouldn't increase the full amount right away. I would just increase in slow steps. But it's taken years to really realize, and lots of experiences to really realize, that the doctors do have lots of contradictions between one and the other. And I've learned that they're not gods. They don't know everything. And they're a lot of the time it's their best guess, and it's a very educated guess, and they have my son's best interests at heart. They all want to do the best for him, but based on their research or their experiences, they put emphasis on different things. And so like Mike said, I'm the one that hears everybody's point of view, brings it all together, and tries to make sense of it, and then presents it back to them, for kind of, I guess, some synthesis, or um, um, what's the word? Like just kind of figuring out how those pieces fit together and what works best for us.
That's really well said. Cleo, I see your hand up. What are your thoughts?
Yeah, I just want to echo what Aaron is saying. It's exactly the same in the beginning. Of course, me and my husband, and then he said I could say his name, Jay. We're very like, let's listen to everything. He's more vocal than me. He's more of a outward personality than I am. But I realize as time go on and contradicting exactly what Aaron said, contradicting things or things that just didn't work, medications that didn't work, things that didn't work. We had to learn to speak up. And I also said to him, since he was the one that was going there, you need to speak up, things that you need, anything that comes up. And he does it, even if he bugs them. We laugh about it because sometimes he'll bug them about everything. Oh, there's something on my foot. Something doesn't look right. He'll bring it to them, even though sometimes they don't want to deal with that. He makes them deal with it because sometimes you find out, oh, there's an infection that might hurt him. And you're not seeing, for my husband's case, he goes to hemodialysis, and he's going, right now he's going like 4 days a week. So he sees them more than a GP. The GP won't know, because sometimes they will say, well, go see your GP. Well, the GP might say, hey, I want to hear what your nephrologist is saying. So he pushes for himself, and you have to learn to discern what you're hearing and come to them and say, hey, that doctor on the last rotation said this. Are we sure this is working? Because not every medication or everything is going to work for everybody. Our bodies are individual, and it's going to affect you differently. That's what I've learned, and just learn to speak up on it.
That's really well said, and I like how you described you working with your husband. You're a team, in effect. Kathy, I'm curious, as a frontline healthcare provider, does it take time for patients and families to work up the courage to ask questions? How do you support that?
I really appreciate what Aaron and Cleo have said. And as a nurse working in a kidney care clinic, I would definitely be dealing with patients that came with various concerns, and GPs letting them know of one version, other specialists telling them what they should do. And I think the best thing is to take like ownership on your own and empower the patient, and like I felt encouraging them to ask the questions to make them feel comfortable. But it takes time for some people to feel that comfort. And like Aaron said, initially, the doctors are gods. Well, when you start into the healthcare system, it doesn't take long to figure out that they have different opinions. I mean, they do know a lot, but it doesn't always mean the best way. And so, if you can do your research, it does help a lot, and having that conversation and feeling comfortable to share. But a lot of patients don't even know what to ask, right? Sometimes people are overwhelmed with their disease. They don't even, some people feel normal with kidney disease. People can have a kidney function of 20%, 15%, and still feel, you know, completely healthy and normal. And some of them don't even want to trust the healthcare professionals to say your creatinine is really high, your kidney function is low, this is what we need to do. So it's just building trust, and it's regular visits, connecting with them, listening, and hopefully that empowers patients to just feel comfortable to ask the questions. Um, but I do empathize with those experiences that you had. I believe that's pretty common. Myself as a mom, just in the healthcare system with my kids over the years, I can empathize with that. And it is really, the patient does know themselves the best. And it's so important just to share your experience and what is going on. So,
Thanks, Kathy.
mhm.
Mike, I'm curious, do different healthcare providers respond to questions differently? You've seen a lot of healthcare providers. I mean, you were a young man when you started this journey.
Mhm.
Was everyone receptive to you asking for clarification or to ask for a second opinions,
Yeah.
perhaps?
Um, well, I guess fortunately or not fortunately, my healthcare journey has spanned a lot of decades, and I definitely think that the acceptance of patients as equal partners in their own healthcare is something that has really come to the fore in the last 10 to 15 years. Um, and without sounding ageist, um, that also goes for the medical excuse me, the medical staff. So some of the older doctors that were trained like in their generation would not have ever really been exposed to patient-centered care. Um, some of them get it inherently, but it wasn't part of their learning experience. Whereas a lot of the newer, younger doctors now, I find are much more they're much more willing to sort of break that dynamic. So a lot of times I'll get doctors now that'll introduce by their first name. It's not Dr. Smith. It's, hey, my name's John. You're Mike, right? Like, so it deformalizes it, de-emphasizes that power imbalance. Um, and yeah, so it definitely has changed. You do have to be somewhat like before you go in, like really guns a blazing, you have to really feel out a particular doctor's receptiveness to um, to asking questions or how to ask the questions. Um, it was something Cleo said that made me think of this is you really need to have a strategy when you are um, when you're connecting with people. And this is just society in general. This is um, it could happen in your workplace, in your day-to-day activities. um, Not everyone operates on the same language, the same level of knowledge into a conversation, and so you just have to be um, willing to shift your view or the way you communicate with someone, especially if you're asking them to do something for you. Um, you have to try and shift your method of communication to adapt to them. I can't hear you, Greg.
Sorry, I'm mute. Erin, I'm curious. You mentioned earlier that you were being the good mom in conversations. What's your strategy to build trust with healthcare providers? How do you get them to meet you as an equal? You're the expert. What's your strategy? What works and what do you do when it doesn't work?
Well, I love that trust came up with Kathy and Mike as well there, because I actually have it written on a sticky note here. I have the word trust there. That's so key to being able to get through this journey, is building a trust with your medical team. And I imagine most of you, and probably everyone, is like us, and we have a vast medical team. It's not one nephrologist, they rotate. And so that's where you get the different opinions, which can be good and really frustrating. But in order to be heard and feel safe, trust has been really big for me, and building rapport with the medical team. And that takes time when your doctors are rotating, but it's not going to happen right away. But how you build trust with anybody is having a respectful relationship with them. And like Mike said, and Cleo too, asking the right questions. And I mean, I hate to say the right questions, because I think that puts pressure on us to have the right questions, but just asking any questions. And as you ask questions, even if you're like embarrassed to ask them, and I've been laughed at a couple of times, and I'll give them a hard time about it now. You laughed at me about this once before, but I'm asking it again. um, and asking lots of questions, listening, asking some more, being friendly and polite, and kind of getting to know the different personalities of your medical team. And all there's things I'll wait and I'll be like, this doctor isn't on this week. I'm gonna wait until the one I want to talk to about this particular thing is on, because we have a different rapport, and I know that doctor well enough to know sort of how they're going to communicate with me and what angle they're going to take. And then I might hear something from one doctor and say, next week when the next doctor comes on, I'm asking this question again, so I can get the other perspective and kind of put them all together. So with a trust, it doesn't get rid of frustrations or worries, but it helps you move forward, helps you develop a plan, and just makes you, and it also makes you feel like you are a member of that team.
Well said. Cleo, I'm wondering how you build trust. Different providers interact with you differently. What's your strategy for building trust and making them see you and your husband as equals who need to be provided the right information? What works?
I think it's kind of developed over time. I again, what Erin and Mike has said is is so true, and it's almost a similar thing. Like the example Aaron gave about the rotation of doctors. So it's building trust with them. Like I said, my husband's very more of an outward personality, so he'll joke around. He knows everybody down to the porters. So we go in a hospital setting. So he's at the hospital, which he gets picked up by transport and gets taken there. So he has his dialysis there. So he knows everybody. Everybody in the hospital, he knows him too. So I think that's good. He jokes around with them. Everybody from the support team, the everybody he talks to and treats them all equally, including the doctor. So I think it starts with that. And that helped me because he's more of a talker. And that helped me connect. And again, what Aaron said, I don't know if there was much of a strategy. I think just him talking and bringing down those walls helped, and seeing them as like an equal, and learning their personalities, like Mike was saying also. And then, as the rotation comes around, which doctor do I want to talk to? There's more, some who don't rush through it, some are more better listeners, there for your care. Even though our main nephrologist is there also, sometimes there's always a secondary one. We're like, oh yeah, that's the one we want to talk to. He'll look into this. So that's helpful. So I don't know if there's much of a strategy, because in the beginning it's kind of all over the place. It's kind of just like get your questions out. We know during the week you got to get it out, because the weekend you may not, because sometimes he goes on a Sunday, you won't get anybody and you won't get it answered. So wait till Monday or Tuesday or whatever day that is that you go on. I don't know. I think over time you just build your own strategy and what works. So just be kind to everybody and be talkative, and you'll find out through that. Hmm.
That's really good advice, Cleo. Kathy, I'm wondering, someone perhaps is um, their first clinic appointment in the multi-care kidney clinic or in the transplant workup. How do you suggest patients and families come to those first initial meetings better prepared? What words of advice can you offer them?
Well, listening to the three other panelists here and how you do your best to communicate and connect with your care providers, you are star patients, and it's patients or families, and it's very obvious you have a high level of communication skills and how to do that simple balance in order to get your families or your own needs met. Unfortunately, there's so many patients that that just aren't at that place of having that level of communication, whether it's not having English as their first language, um, feeling ill, just different situations where maybe that trust, that they've really had a hard time with the healthcare system, and trust is really hard to come by. But in all this, all of you have taken the high road. But I really think, and it's a challenge to all healthcare professionals, we need to take the extra high road, in that we're the professionals and we need to do our best to make our patients feel comfortable, to make our patients feel heard, and family members alike. So that is my goal, whether I'm in the kidney care clinic or helping someone along with their transplant workup. Usually, when I meet them at first, it's really trying to figure out where they're at, listen to the patient. Some come informed with their notebooks and they've got a pen in hand, and they're ready to take down any information. They've already got their questions, so I know I can already shift to giving that information, and they're ready to receive it. Some patients are coming in and they don't even really understand what is going on. Um, they don't know what the kidneys actually do, and so sometimes it's educating from just a very basic level, so they can understand at a basic level what's going on, and then at the next appointment either reinforcing, well, really assessing what they have actually remembered, or many times they don't recall those conversations and we need to repeat. So it's up to the healthcare professional really to understand where the patient or family member is at. And I don't know if we always meet that. I don't know if I always meet that, but it's definitely a goal of mine, to know where people are at and then what their questions are. I do encourage patients from that first meeting, I know you're going to have a lot of questions between now and the next time you see us. Uh, get a notebook, start writing questions. No question is too silly. I'd love if you have the questions, someone else probably does too. So whether it's a one-on-one visit or in a classroom setting. And then I usually like to buddy them up with um, uh, a patient, um, a patient advocate, someone who's been there, who is someone where can meet them where they're at. And sometimes patients may receive that in an easier way as well. I see a hand up there, so I'm happy
Yeah,
to include Mike.
I would like Mike to weigh in, and a great question came in through the panel that I'm going to ask after Mike weighs in. What are you thinking, Mike?
Uh, so I think I'd like to challenge Kathy a little bit.
Yep.
So some of the things you said there sort of reinforce, like there's an extra high road that like medical staff can attain that us patients can't. To me, it's all about equality, like understanding that like like whenever I talk to patients, whether it be in a forum or one-on-one, like it's
Yep.
really about establishing that level of equality. And it's not like, and that is built by, um, not like I'm not high, like I'm not speaking any higher
Yep.
than anyone else, and vice versa. So that's one thing. And I think it was something, sorry if I'm mixing it up, I think it was Cleo said um about the strategy. And a lot of times we're all not all at our best all the time, right? And that includes the medical
Yep.
staff. So you could
Absolutely.
have you could have a sick child at home, you could have elderly parents that you're dealing with outside of work. As a patient, you could be, I describe the kidney journey as being mostly flat, but then there's speed bumps along the way. And sometimes people get like catch on a speed bump day and you're not in
Hmm.
the right frame of mind. And it's just like that's where the sort of mutual respect comes from.
Yes.
Like just understand that not everyone's on the top of their game every day.
Well said. I
Yeah,
agree with you, Mike.
yeah, I agree. And this ties into the question, and it's a good one. Someone's asking any tips on overcoming any possible imposter syndrome during interactions with the healthcare team. One
Hmm.
of the panelists, I think it might have been Aaron, talked about being laughed at. And this
Hmm.
person asking the question is saying, as someone with a bit of social anxiety, that would reinforce that imposter syndrome. Like, am
Mhm.
I equipped? Am I allowed to ask questions? And I think this ties into what Mike says. People receiving care feel vulnerable and feel weak. Anyone have some tips on how you build the confidence to believe you deserve to be in that room asking questions? Anyone?
I don't know
Someone
if
else
I have
says
a
I'm
specific
oh,
tip. Oh, sorry. I
go
don't know
ahead,
if I have
Aaron.
a specific tip, but I can say that I am an introvert. I am definitely kind of that one that doesn't want to rock the boat. I don't want to have the black mark against my name. And learning to have confidence in that clinic room or treatment room, um, like building trust, takes time. And I guess maybe my tip, because I'm mom to a number of introverts who I'm always telling, you know what, it's hard. Have a big breath, do some positive self-talk, and just keep going. And yes, I've been laughed at a couple times about a couple things, and I'm the first time it happened, it was pretty hurtful. And I ended up writing an email afterwards saying, this is how this made me feel. And I was terrified to press send on that email. Um, but I did it, and I got a call back, and we were able to discuss things. And every time you do, you build that confidence and you build that relationship and you grow that trust. And when it's happened to me and I've faced it afterwards, I've dealt with my insecurities and fear afterwards by going back to them, even though that was probably even scarier. The end result has been a better relationship with the medical team than previous.
I'm glad. Cleo, what are your thoughts?
Yeah, again, just like Erin, I can I feel we have probably similar personalities. I started out very timid and I'm more of an introverted type of person. Um, Doing panels like this is probably easy because it's, via Zoom. And I've learned through my husband actually to speak up more. But sometimes he'll be the one pushing and saying, "Go ask them this, go do this." I'm like, "No, no, 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 no. I don't want to, I don't want to ask the doctor. I want to get them on our bad side." And I learned over time just
Mm.
keeping things or writing it down, I find.
Yeah.
If I'm going to
Yeah.
something, and you always hear that, write down your question. I'm thinking, why? But if I had something really pressing, because you do forget over time, there's so many appointments, so many things, the lack of sleep, everything.
Mhm.
So I write it down. So at least if it's coming up or whatever whatever doctor he needs to ask, I have it written down. I tell him, don't forget to ask this, or I will, if I'm there, I will say, oh, do we have a question about this drug or this appointment, or is this necessary? And we get the background. That also, when you're talking about what has happened and then things you need to speak up about. Also, when we did home dialysis, this is near the pandemic. I did home dialysis, so I learned how to run the whole machine. This is a hemodialysis machine. That kind of helped me understand how the machine run, but it also helped me understand how many people it takes to do this. Doing it alone, at least for me, did not work out. And talking about writing letters, I did complain and saying there was enough support, and that's what happened in our case. There was enough support to carry this on at home. It was a bit scary for at least for me to do, and it was just too stressful. And I would say to the team that's kind of promoting this, let the patients know the scary parts of doing any kind of
Mm.
home dialysis or anything you're going into, because if you're open about that, I know they don't want to show that, but I say do, because I find that they step away maybe from some of those scary sides, like everything. Because I find I went in, they're like, "Oh, it's great. You're gonna have lots of time all day." It's like, "Oh, you're wrong." I was stuck in a room doing dialysis like many hours. And when you see the team now that takes to put the machine together, take it down, can imagine one person doing that. So I was like, give us all the scenario. Our brains can absorb it. I can learn it. I know that maybe not everybody's able to maybe understand. Like they said, sometimes it's a language barrier, but try me. And then maybe I would have understood like, ooh, is this for me? How much support do I have at home? We weren't asked that, but it was a learning curve. And at least I know now, like that's not for me. Some people, hey, it works beautifully. Um, and just to speak up about that, and at least we were engaged enough that we can say, hey, this is what works for us and what doesn't. And I think that helps. And writing things down, like I said before.
So better to have the unvarnished truth, the upsides, the downsides. So you,
Yes,
you can
yes.
make, you and your husband can make a decision that aligns with your preferences and abilities.
Yeah,
It's a great
I
point to make.
feel like they market. That would be the only negative. Even though our teams are great, I would say our dialysis team is really great. Like I said, great rapport. But some things I think they hide. They kind of stay
Mm.
away from the bad side of things. It's like, let's just talk about it. Let's bring it all out, because then at least the patient will be aware. Like, okay, because I hear people who are, I'm going to call it marketing or selling. Hey, you want to do it at home? And I remember talking to the gentleman, he was new to us. And I said, do you understand what it takes? Do you understand? I said, ask him these questions. And he was totally new to dialysis. And I do advocate for some people, and so does my husband. And say, please go and ask them these questions before you do it. Because sometimes you just tell them, hey, you can do this at home, and here's the pamphlets, and here's the stuff. And then the person's like, oh, they told me you can do this. I'm like, who else do you have at home to help you? You're about 80 years old and you're by yourself. Are you sure you can do this on your own? So these are things they need to do. Let's look at the all sides so you have an informed decision.
Yeah,
Mhm.
thanks for raising that. And I think Kathy mentioned this. She tries to integrate, at least from what I understand, connecting people with other people facing the same situation. The value of peer support, people with lived
Right.
experience saying, I was worried about this too, and this is how my wife and I approached it, and this is what worked and what didn't. Am I paraphrasing that correctly, Kathy?
No, that's exactly correct. I know in the clinic when I was there, sometimes the home dialysis, the home hemo, or the home PD clinics were happening at the same time as the pre-dialysis clinics, and from time to time, it. I mean, we could always get a patient or set up a patient to talk to another person, but sometimes we would have patients that were there who were experiencing PD or HD, and then we'd have a patient in our pre-clinic contemplating or trying to decide what would be the best option for them, PD or HD. And I could see firsthand what a difference it made for the patient to hear from another patient who's living through it, as opposed to me as the healthcare person giving them my version, which is educated, and I try as best as I can to make it what is reality. But there's nothing that beats to have another peer or another patient give their information. So I try to, well, we as a facility, we try to set that up with transplant or with dialysis choices and options.
I'm glad I caught that. I think it's important. And I
Yeah.
think this ties back to the original question. How do you get over that imposter syndrome? I think speaking with other people struggling too,
Yes.
you come to understand you're not alone.
Right.
You remain an expert in yourself. And I hope that sort of answered the question. It was a very good one. I wanted to pose the second poll question, and it will appear. I'm curious, what is the biggest barrier to self-advocacy for you? And you can choose from lack of confidence, fear of judgment or conflict, not knowing what to say or ask, or even cultural or language barriers. Take a moment to complete the survey. Terrific. Thank you for weighing in, everyone. I wanted to ask, and we can maybe start with Kathy. What's the danger if people don't self-advocate in terms of
Mm.
are health outcomes different? Are their experiences of care different? Can it affect their quality of life?
Um, I don't have written evidence, but from my experience, what I can see is when patients really are not advocating for themselves, not really taking charge of their health, or really even that interested in how to help themselves. Yeah, outcomes are um, not as good, I guess, especially with choices in dialysis. Many patients that I've experienced may be in a state of denial of where their disease process is at. They don't want to make decisions, and here now they find themselves a kidney function of 5%, and there's no option for a fistula. There's no option to learn about PD and go at it in a slow way. It's just, immediate dialysis required. And so right there, they have not been given that option to choose the best type of treatment for them. Some of them have a kidney function of 20%, and I've been invited to talk to them about transplant and the options down the road, and to consider learning about it, what there is available for, or how you can find potential living donors. But when patients haven't bought in or advocated or learned about their own disease, they're just leaving it up to what will happen with their health and not being able to make those decisions ahead of time. Granted, everybody's in a different place and dealing with their own things. So, everybody has their own journey. But I do see some patients, they've come into the pre-dialysis clinic, GFR of 17. They already have talked about to their family, well, I know I need a kidney. They've already done some of their own homework. They're already gone over that speed bump of, okay, they're already accepting their situation, and they want to get, starting with transplant workup because they have a living donor already waiting. It prevents them from even needing to seek hemodialysis, PD, becoming very ill. So I guess everybody's at their own journey, and there's no judgment here. Like, I think it's truly such an individual thing, and everybody comes to the table with either that confidence to advocate for themselves, or that imposter syndrome where, like, I'm not supposed to know anything. It's the doctor that knows everything, which we know is not correct. Um, but everybody comes at their own time and place, and everybody's journey is so unique. And I, as a healthcare professional, I think it's my job to try and understand best where my patient is at and how can I help them where they're at. Um, it's not a perfect journey, but definitely try our best. But happy to hear from the panel here what their thoughts are.
Yeah, would anyone else like to weigh in on the danger of not speaking up and not self-advocating, perhaps in your own journey or someone else you've seen?
I'll take a crack at that, Greg.
Yeah,
Um, so I think, well, the obvious, or at least I think it's obvious, downside to not self-advocating is falling through the cracks.
Yes.
Um,
Yeah. Yes.
and so if you've established that you're not gonna, you know, like, again, it comes down to communication style and whatnot. Like, if people know that you're not gonna yell and scream and swear and all that stuff, then when you do get a little bit agitated, they're like, "Whew, this isn't normal." So I think
Mhm.
establishing that sort of level of understanding of what type of person you are, um, is really helps it to start off with. And then the the imposter syndrome, I mean, it's your body, it's your illness. So I don't think not to downplay people having imposter syndrome, but you're the only person that knows your body the best. You may not know the medicine behind it and all that, but you know how a treatment feels, a medication feels. Um, and no one, like, we don't have screens on our backs that you can read that is telling other people how you feel. You're the only one that can communicate that. So I would like to, I would like for people to understand that they are the best people to speak on their own behalf.
I'm glad you said it like that, Mike. Aaron, I'm curious if you could go back in time and visit yourself 9 years ago. Um, would you have done anything differently? Would you have approached supporting Daxton in any different way? Are there questions you would have asked, approaches you would have taken? Can you reflect on that?
Um, I'm pretty proud of how we've handled all of it, and it's been a roller coaster ride, as I'm sure most people can relate to. Um, I would have, if I could take my more confident, more knowledgeable self from today and send her back to those first clinic appointments and stuff, I probably would have felt safer and more in control in the beginning sooner. Um, that'd be my biggest thing. Like in terms of that, the dangers of not self-advocating. Um, when you do, you feel like more of a member of that team and you feel like you have more control. which I think just your overall experience of the kidney journey is if I could go back, I would have been more confident. I would have had that idea that I am part of the team right from the beginning. But again, that's probably not, that is something that takes time to develop for probably most people.
Agreed. Cleo, I wonder, any lessons learned your journey with your husband that you think are critically important? If you cross paths with someone in a clinic who had that terrified look of first diagnosis or the need to decide on treatment facing them, what are the words of wisdom you would offer them?
Hmm. Words of wisdom.
A lot of pressure.
I know. I think it comes with time. Like all the panelists are saying, um, come with your questions. But even though you don't even know what questions to ask, because in the beginning you're just absorbing it all and it's just a blur. So come with as many questions and keep coming with the questions. I think that's what it is. Don't stop, because you might think, hey, it's been a week later and now I'm ready to ask that question. Uh, Again, that's okay, because that's happened to me. You go into an appointment and as soon as you leave, maybe a day later, hey, I should have asked this. You know what? I'm gonna call them up and ask them. Sometimes I feel I shouldn't, and then sometimes I'm like, this is really important. I better ask, right? So I said that's okay. Keep your questions coming, because things change, just like the panelists know. Your body changes, things change over time, over years. Maybe what was good for you last week doesn't work this week, just like what the nurses and everyone has to do. They have to sometimes change your solution, how much you're getting, maybe the weight's up, weight's down, whatever's going on with you. So same thing. Just come back to them and be okay and open enough to say, this is going on with me now. What plan do I need to change? We're constantly changing our plan year to year. Um, when you're not engaged, when a patient's not engaged, it's happened recently to a dialysis friend who became friends. Unfortunately, the wife passed away. She was very disengaged. And unfortunately, like I said, she passed away only last month, or beginning of this month, really. Um, and she just, I think what was happening to her is her mental health issues started kicking in stronger, and she disengaged herself from the team to the point she just didn't want dialysis anymore. So that's the unfortunate side. Um, her husband also became ill and was in the hospital. So I think combination of things that were going on in her personal life added to that, and she just wasn't engaging with them anymore. So unfortunately, we did try to reach out to her and get her going, but that's what could happen. Someone can say they get so deep, maybe in what's going on mentally, and the depression of it kicks in of what's going on with them, that they do disengage from the whole thing and say, well, that's it for me. I don't want to do this. And maybe unfortunately, she didn't get, I don't know, her care on the side, didn't get that chance to talk it out. What's going on with you? What's happening? How can we help more? She just didn't want to talk to them. They would pick her up. She would come and then she would just turn around and say, nope, I'm not going to send me home. I don't want dialysis today. So that's an unfortunate thing. And even though we are supporting and helping the husband through this, that's something to think about when people get disengaged, maybe to kick up that care or kick up what's going on, especially combination. Like I said, our team is pretty good. I don't know all the sides of it, but kick up maybe that mental health care too, because it's a combination. Because mentally you go through a lot. Even the support, us who are the caregivers, we're supporting. Yeah, it's a combination. The family needs that chance to talk and help overall.
Thanks, Cleo.
Mhm.
Susan, thank you for posting in the chat your question around early diagnosis and being anxious about having access to what you need. I would encourage you, we won't have time today to address it as a panel, but please reach out to your local branch of the Kidney Foundation. There's much of what we have that
Mhm.
can help you manage kidney health and protect your kidney function in the moment. And Erin, great words of wisdom. Connect with people. Nurses are your friend. I love it. With that, Thank you, panelists, for such an engaging conversation. As we draw to a close, I would like to ask one last poll question. What tool or strategy from the webinar do you think will help you most? It could be question planning techniques. It could be tips for confident communication. It could be knowledge of your rights and responsibilities. And it might be peer support or community connections. Take a moment, please, to offer your thoughts. Interesting. Thank you again, panelists, for such an engaging discussion. To attendees, if your question wasn't answered, please send it by email to kidneyprograms@kidney.ca. The Kidney Foundation is committed to providing information and educational resources about kidneys and kidney disease. Through our regional branch offices, we offer advice and support about accessing services within the healthcare system, assisting people to access other supports in their community and helping build skills for self-advocacy. We invite you to contact us if you have further questions, to speak with someone in your community, or to access further education resources and materials. When today's webinar ends, your computer will open to a new page requesting that you complete our webinar satisfaction survey. Your feedback is really important to help us continue to improve this webinar series. We would really appreciate it if you could take a moment to complete it. The survey is available in both English and French. You will find the language toggle in the upper right corner of your screen. Carrie, the last words are yours.
Thank you, Craig. On behalf of the Kidney Foundation of Canada, thank you for attending today's webinar, Self-Advocacy and Kidney Disease. Have a lovely afternoon.